Jenny, that's
Hi.
my mentor. And yeah. Good afternoon, everyone. I'm Rebecca John Jay Singh, and I'm here to give you some information about admission procedure. Because most of the time, students, we rarely get this chance of doing admission procedure, unlike the other procedures in the ward. So I decided to share some knowledge on how to be confident in doing admission procedure. Okay, so this is Alicia, my student, and Emma, Angela, and Kansha. Yes? Yeah, thanks for coming, and thanks for coming, Jenny.
That's okay.
Right. In the ward, this is the one procedure that you can leave it incomplete. Yeah, like observation, all parameters you need to do when you're doing a set of obs, temperature, pulse, respiration. You can't leave anything. But admission, it is 24 hours process. If you get an admission in your shift, you don't need to complete everything. Okay, so you can prioritize what is important during admission and then do that one and leave the rest for the next shift, whoever is coming on. Yeah, it is important that you prioritize what is important, really. And the proper handover of what needs to be done is also important. Okay, so as per your profile, I can see that some of you are good at doing the admission procedure. I can see some of you needs more information on that. So I'm happy to provide that. Before we start, I have a checklist to go through, which we use in the ward. Okay, when you say admission, this is the form you need to take into account. Yeah, so this form has everything you need to do during the time of admission. Yeah, so which includes, first of all, you need to identify the patient. How will you identify? Emma?
Asking them their name.
Correct. Yes. Same as checking the rights. Yeah. Any idea, Angela?
Their birthday.
Absolutely correct. Anything else? Well done, Emma. Any idea? Address can be another one. Yeah. Some of them can say, some of them cannot, but we always make sure that we're on the same page. So that's the way we check ID of the patient first as soon as they come to our ward. They may be coming from ED to Canning Medical Ward or rehab, or they are coming straight from community. Yeah. So wherever they come from, if they don't have an ID, we need to give them the ID. That's the first thing you need to do. Yeah. So then you need to do ward orientation as per this handouts. First thing is the ward orientation. It's important, isn't it? Especially people with no memory power. They need to know where they are and why they are there. Yeah. So under ward orientation, what are the things you introduce? Any idea?
Toilets.
Correct. Very important. Excellent. Anything else?
Fire exits.
Fire exits. Yeah. Some very basic things like they may be thinking the television is, we have to pay for it. So they will not watch any television thinking that they have to pay for it. So tell them that the television is free, the telephone is free, and what is the routine of the ward, what time they are expected to be up in the morning. For example, rehab ward, they are expected to do a lot of activities. Yeah, group therapy sessions, they are expected to attend. So it's good that they know it beforehand. Yeah, and things like laundry services. If they use the personal clothes, the family has to do the laundry. Hospital clothes, of course, we do. Then it's not must, but sometimes we help them as well. If there's no family, we help them. So these are the basic things we introduce. Who are you? And do say, I'm Rebecca. I'll be your nurse for this afternoon shift. I'll be leaving 9:30. So you can introduce yourself and surroundings to the ward first. So that's all in this form. It's very self-prompting. So first of all, you introduce the call bell. So in that call bell, it has a switch for the television, it has a light there, and volume up and down and channel up and down for the television as well. Some people, unless you tell them, they don't know. So it's very useful. They'll be boring really the whole day. They won't be doing nothing. So it's useful for them to know these things. Call bell. Next is visiting hours. It's all changed now, but it used to be different before COVID. So rehab especially, we give them a little bit of time to rest between 1 to 3. Give them time to rest. And telephone free, I told you, TV is free, laundry, meal times, and rehab follows. Then admission observation continues. That's the first thing you cannot avoid. You need to do a set of obs on them. It has temperature, supine and erect BP. If they're able to stand with one assist, you do supine and erect. Blood sugar, regardless of their age, regardless of their past history, medical history, you do blood sugar for them, random one. Check their weight. Ideally, first thing in the morning. That's what I'm saying. You are in the afternoon shift, you receive an admission. That can be done tomorrow morning. You don't have to do that. So that's how you prioritize what can be done, what can be handed over to other staff. And ECG, of course, mainly if they have any cardiac history, you do ECG, oxygen saturation and respiration, drug allergy. By doing ID check, you also give red or white band. Give them red if they're allergic to something. If they're not allergic to anything, white. Yeah? And AMTS, any idea what it stands for? Especially for rehab. We got A, abbreviated, M for mental test scoring, AMTS. This is 10 questions. It has got 10 questions. Why do you think we need to test their memory? Why? It is very quick, 10 questions. What's your name? What's your age? What's the current year? So things like that. What do you think? Why we check?
Just to see if they're oriented.
Yes, yes. This is mainly for safety reasons, yeah. How well they are able to retain safety instructions. If you say, call me, you're checking their memory if they can retain that safety instruction. That is why we do AMTS test. Yeah. It's not only rehab, I think other wards has the memory test, yes, as well, just to check safety needs. And if they score 7 or less, we need to intervene. Yeah. If 7 and above, that's fine, we just monitor them. But 7 and low, these are the safety needs we do for them. So one is bed rails. Bed rails, just one side, both sides, it needs to be consented, so restraint. So bed rails can be used. Invisibeam, that's a sensor. You must have come across invisibeams in the ward. It's a sensor. No, we have in rehab. It's like a sensor just next to their bed. It captures their movement. Even if patient is forgetting to call, this tells us that the patient is on move. So that really helps. Hill-Rom bed, which is very high-tech bed. It's got the bed alarm system in it itself. Non-slip mat, protein bed. Protein bed is something which can come very low to the floor level. Even if they have tendency to roll out, it's not a big height they have to fall. So that's the protein bed. Wander alert, it's like a watch kind of thing. If they escape, it tells us the patient is out of the ward. So wander alert. And consent form, if you need for any of this, it's completed. Okay, so that's safety needs we'll be doing. That's why we do MTS. Post-white bladder scans, elderly patients especially, how well they're able to empty their bladder each time. Especially with community admissions, they just straight come from home. The ability to empty the bladder is not investigated before. So that's why we just do random post-white bladder scans 3 times. Again, this one, you don't need to do all 3. Just do one if you can. Even you can't do one, you're very busy, that's fine. You need to prioritize and hand it over to the next shift. And FRAM, any idea what is FRAM stands for?
False risk assessment management plan.
Absolutely, well done. So yeah, false risk assessment management plan. You must have seen this before. Got And out here, this is frank. Yes? Okay, so that's frank. You fill, see, by doing this one form alone, it directs you to fill up some other forms as well. Yeah? And comprehensive skin assessment as well. That's the skin assessment form we have in the ward. We need to fill that up. Again, this is has to be done in 24 hours time. Has got money or jewels, whatever it is, we take that one. If they say it's lost, this is the form we look for. Did they come with it first of all, or they are making stories? It had happened before, so that's why everything's documented. And your signature, patient signature, they are agreeing with the same. Okay, so this is what is admission procedure is. Make it simple. You don't have to do everything. Prioritize, and then you can. Any questions?
What if you do a blood glucose on admission, but they just had a sugary treat or something, so the blood glucose is higher than normal? So would you redo it another time?
Ideally, blood sugar should be checked when? Pre-meal or 2 hours post-prandial. Post-prandial means after food. So make it ideally before meal. So 2 o'clock patient comes, wait for 2 more hours, then you can do at 4 or 4:30, that's fine.
Because then you know they haven't eaten for those 2 hours.
That's right.
Okay.
You're very sure that there's no food for the 2 hours. That's, yeah. And it depends what time the patient comes. 7 o'clock in the night, you're getting admission, wait for that 9 o'clock, because 7 o'clock they usually get supper. Yeah. So that's how it is. Yeah.
Thank you.
Yeah, no worries. So you are okay with that admission procedure now? Maybe slightly different in acute ward setup. Little more information added or taken off. So many things from rehab you don't need to do in acute setup, like post-white bath scans. They don't do in medical setup. So confidence. When you know things, you're confident. No, I can do this. I have come across students, once they get admission, they get worried and they think, oh, everything we have to do, I got admission. And even staff, not only students, even staff, they get so much stressed if they get admission. Okay, any more questions? Happy with everything? Good. Thanks for joining. And then maybe if I happen to see you next time, I can share you how to really do an admission in the ward setup, like checking weight and introducing yourself to the patient, how to do it. I'll show you in the next session if it's possible. All right?
Thank you.
All good. Thanks. Thank you, Jenny. Thank you. Okay. I'll give you the handouts. You just pass it on to the, it's got 4 pages there. This is the rehab admission I was going through. Thank you. This is, I think, Canning. And myself here. Okay, Angel, on this one for you. Thank you. Good. How's your shift going today?
Good. Yeah. We've noticed a few things with one of my patients that hasn't actually been filled out with the admission form, so we're going to start doing it today, like the baseline weight and everything.
That's
so yeah,
right.
It's good to see this and then compare it to what
That's right, isn't it? Well, thank you. That's a good feedback. Yeah, it's easy when you know it. Well done. Very good. It's one of your requirements, isn't it, to do admission? Your stage?
Yeah, it is.
Yes.
Yeah. So hopefully by the end of it we'll be able to do maybe a whole admission class, or like with an RN present as well. But.
Yes. Yeah, we don't get admission that many. Rehab, very seldom. Yeah, after hours especially. But Canning, you may get admission from ED, yes.
Yeah.
They just come anytime. Right. You can go for lunch or a cuppa, whatever you want. Okay, thank you. Thank you very much.
Thank you.